Did you know heart disease is the leading cause of death for both men and women? It's preventable and controllable, though. Dr. Quinn Pack from Baystate Health clarifies and informs us about fighting off this killer.
Genetics have influenced lots of things in our life, right? Cancer risk, heart disease risk, pneumonia, or infection risk. And that's not different for heart disease. And genetics do play an important role in the prediction for heart disease risk. And if you have a mother who had a heart attack before age 65 or a father who had a heart attack before age 55, that's considered a classic risk factor for you. Now, it isn't something that you can control, though, right? So I can't control my genetics. I can't control many of the things of the environment in which I grew up. But genetics does turn out to be a relatively important risk factor for heart disease. It's not the most important, though.
Well, we're going to get into some ways to prevent heart disease, but first I want to talk about, does heart disease impact both men and women equally?
Yeah, so this is a common misconception, actually, among women, that breast cancer is the leading cause of death, or maybe osteoporosis from bone fractures, or frailty, or other forms of cancer. It turns out that heart disease is the #1 killer of women in the United States, far outstripping breast cancer. Heart disease and stroke are the #1 causes for women. Women tend to have their heart attacks a little bit later in life. They seem to be protected by the childbearing estrogen years, but they catch up and surpass men into their 70s and 80s and actually have much higher rates late in life.
Now, there are some tips, some guidelines out there to help lower that risk of heart disease. Share some with us.
Right. So the American Heart Association has established really 7 key steps for reducing your heart risk, and probably the most important one is to stop smoking. Smoking is responsible for many other diseases besides heart disease. It's not just lung cancer. Smoking also has a strong role in stroke. Smoking has a strong role in heart disease. It has a strong role in aneurysms and peripheral vascular disease. And so simply quitting smoking is the single most important thing that a person can do for their heart health.
And it's never too late to quit smoking, even if somebody's in their later years.
That's correct. And there's actually a recent study that suggested that if you quit smoking by the time you're about 40, you're going to avoid most of the consequences of smoking, but that it is never too late. Even someone who is 70 years old will have benefits of quitting smoking at that age.
All right, and there were some other things that you didn't mention as well.
Yeah, a couple of the other simple steps that the American Heart Association recommends is managing your blood pressure. This is the other really big topic. The lower the blood pressure, or the better the blood pressure is managed, the lower the risk for heart disease. And risk doubles for every 20 millimeters of blood pressure over 120. So someone who has a blood pressure of 120 versus 140 versus 160 versus 180, their risk goes from normal to 2 times to 4 times to 8 times their risk for heart disease and stroke. There are such good medicines available today that there's almost no good reason not to have a blood pressure that's controlled. The medicines are well tolerated. There's about 50 different medicines that can be used in about 8 different classes. So if you have a side effect to one medicine, there's another option that's available. You just have to be diligent and make sure you control your blood pressure.
And what are some other things that people can be aware of?
Right. So, the other big risk factors are getting your cholesterol controlled. That's also something you can do with your physician. The medicines are well tolerated. We know that exercise is really important for general overall health. Just like tobacco can cause lung cancer and kidney cancer and heart disease, exercise can help treat depression and mental health problems, as well as blood pressure, cholesterol.
So it really seems like it's almost a more holistic approach in your health, in a healthy lifestyle overall, and this will help lower perhaps the rates of...
Yes, exercise reduces risk in all sorts of diseases. So again, reducing risk of hip fracture, bone fracture, digestive health, sexual health, in addition to heart health. And the American guidelines recommend that if you can just get 150 minutes of exercise each week, That's typically 30 minutes today of moderate to intense exercise. That will really make a big difference. And again, that can just be walking. It doesn't have to be triathlons.
Right. We tend to lead a more sedentary lifestyle than maybe our previous generations. Is that kind of tying into maybe a higher rates of heart
Absolutely.
disease?
And I've seen analyses suggesting that we have systematically engineered out physical activity out of our daily lives. We take the escalators and the elevator and we park as close as we can, and we commute half an hour every day. We spend that time sitting when previous generations spent that time on a bicycle or raking or shoveling snow with an old-fashioned shoveler.
Instead of a snowblower.
Yep.
Or living in Florida. So there is a difference then in previous generations. So we have to be probably more cognizant of it now.
Absolutely. Our lifestyle has become very sedentary with television and computers and iPods and iPads where we could just literally sit all day long. But man, just getting up and moving for half an hour every day will help people feel better in so many different ways.
I think the most striking about this is people don't realize heart disease is the leading cause of death for both men and women. They could probably, something else would come to their mind before heart disease, and I guess people don't realize how vitally important their heart is for their overall health and outlook.
Again, it's heart disease is primarily preventable. It's in our control. Much of what we can do is preventable if we'll just be engaged, go to our doctor, and get advice.
So we can control it. We can prevent it. We can control it. We can do something about it. We don't have to just leave it up to
No,
fate.
Heart disease is not left to fate. With the exception of a very few people with bad family history, heart disease is preventable.
All right, great. Thank you so much, Dr. Pack from Baystate Health.
Thank you.